Good morning, learners! Welcome to Valenzuela Live in Mapeh 7. Again, I am your nurse, Marie Anthonette ON-SORIANO from Disiplina Bignay National High School. Are you ready to be healthy? Then let's get it on. But before we start our discussion, here are some important reminders to keep in mind. I think we are now ready. Let me show you the most essential learning competencies. Differentiate healthful from unhealthful strategies in coping stress. Demonstrate various stress management techniques that one can use every day in dealing with stress. Explain the importance of grieving. Demonstrate coping skills in managing loss and grief. Recognizes triggers and warning signs of common mental disorders. Discusses the types, signs, symptoms, and prevention, treatment, and professional care in managing common mental health disorders. Let's have some review on the previous topic in health. Comment your answers below. Type T if the statement is true, and F if the statement is false. Number 1, stress is everywhere. Number 2, it is important to know stress management skills. 3, stress is our body's reaction to harmful situations. 4, stress management skills are techniques one can use to cope up with the harmful effects of stress to our body. 5, stress can make us healthy. 6, smoking is good for the body. 7, a stressed person may experience amnesia. 8, a person who experiences stress may develop poor habits which can affect his or her health. 9, anybody at home can also be a stressor. 10, stress weakens our immune system. And the correct answers are how many of you got the correct answers? Good job, learners. Last time, in health live streaming of Marie Ocampo of Dalandanan National High School, she focused on stress and strategies to cope with. Now, we will differentiate the healthy and unhealthy coping strategies. Problems are part of our lives. It can strengthen us or weaken us, depending on how we deal with them. And every person acts differently when beset with problems. These are the helpful and unhelpful coping strategies. These are the unhelpful coping strategies. Drug or alcohol use, overeating, delaying things to be done, sleeping too much or too little, social withdrawal, self-harm, and violence. These unhealthy strategies can relieve stress instantly. But as you practice them for a long period of time, they have harmful effects to your body. In terms of mental aspect, your brain may be damaged because of the alcohol or prohibited drug intake. As a result, you might experience memory lapse and develop difficulty focusing on things, which may lead to failure or finishing a side task or work in time. In terms of physical aspect, you may feel that your body becomes weaker and may eventually acquire illnesses, infections, or accidental injuries, either of which can even lead to death. For the healthy coping strategies, we have the exercise, talking about your problem, healthy eating, seeking professional help, relaxation techniques like deep breathing, listening to music or doing yoga, using social support, and problem-solving techniques. A healthy strategy in coping stress does not only cater to your body, but to your mind as well. For example, a nutritious diet can make your brain healthy. You will have the ability to think and focus properly and do your task on time. In terms of physical aspect, your body will become stronger and free from illnesses, which will lead to longer life, especially if accompanied with regular exercise. If your body and mind are healthy, you will be able to face any challenges and stress that you encounter in your daily living. Here are some stress management techniques you can use for daily living.
There are times when we all experience feelings of stress or anxiety. In these moments, you can use your breath to help calm those feelings. Box breathing is a simple relaxation technique that can help you reset your breath and return to its normal rhythm. You can do it anywhere, anytime. Box breathing can help reduce stress and improve mood. It can also help with controlling and managing emotions. It's very easy to learn. Imagine breathing around a box. Inhale as you visualize going up one side of the box, gradually filling your lungs with air. When you reach the top, hold your breath for 1 to 5 seconds as you picture going across the top of the box. Exhale gradually as you imagine traveling down the other side of the box. Pause again for 1 to 5 seconds as you go along the bottom of the box. Then repeat. This can be done 7 to 10 times in a row, focusing on the breath. If you can do it sitting down with your feet grounded, that will help too. But really, it can be done anywhere. Box breathing has physiological and psychological benefits. Physiologically, it regulates breath, increases oxygen to the lungs, and can help reduce blood pressure and lower heart rate. Box breathing can help psychologically by providing focus to your breath and removing attention from the things that are causing feelings of stress and anxiety. The repetition of box breathing can also help reduce stress. So, in moments when feelings of stress and anxiety are overwhelming, remember box breathing and the power of your breath as a simple way to relax and breathe a bit easier.
No, wait!
Children feel anxiety just like adults, and anxiety can impact mood, behavior, sleep, and even health.
I've practiced this.
Children can learn simple strategies to calm their minds and bodies, like progressive muscle relaxation. Start by taking slow, deep breaths in through your nose and out through your mouth. Working down the body, slowly and progressively tense a muscle while you inhale. Hold it for a few seconds, then relax the muscle as you exhale.
That's better.
resilient children are better able to handle life's ups and downs. And teaching your child coping skills, like progressive muscle relaxation, is one of the many ways you can help. For more expert advice on raising resilient children, visit strongforlife.com.
There are times when we all experience feelings of stress or anxiety. In these moments, you can use your breath to help calm those feelings. Box breathing is a simple relaxation technique that can help you reset your breath and return to its normal rhythm. You can do it anywhere, anytime. Box breathing can help reduce stress and improve mood. It can also help with controlling and managing emotions. It's very easy to learn. Imagine breathing around a box. Inhale as you visualize going up one side of the box, gradually filling your lungs with air. When you reach the top, hold your breath for 1 to 5 seconds as you picture going across the top of the box. Exhale gradually as you imagine traveling down the other side of the box. Pause again for 1 to 5 seconds as you go along the bottom of the box. Then repeat. This can be done 7 to 10 times in a row, focusing on the breath. If you can do it sitting down with your feet grounded, that will help too. But really, it can be done anywhere. Box breathing has physiological and psychological benefits. Physiologically, it regulates breath, increases oxygen to the lungs, and can help reduce blood pressure and lower heart rate. Box breathing can help psychologically by providing focus to your breath and removing attention from the things that are causing feelings of stress and anxiety. The repetition of box breathing can also help reduce stress. So, in moments when feelings of stress and anxiety are overwhelming, remember box breathing and the power of your breath as a simple way to relax and breathe a bit easier.
Let's now go on to our next topic, the importance of grieving. Let us first identify death. Death is a part of one's life. It refers to the end of the physical being of a person that is caused by an illness, aging, or an accident. It is irreversible and we must accept it. Loss. It occurs when someone dies or life situation change or end. It is defined as having something or someone leave or be taken away from you. Grief. It refers to the social suffering caused by a loss, disaster, or misfortune. It is a feeling of extreme sadness. Grieving is normal, natural, and healthy response to loss. Grief or grieving is the result of death or loss. It is when something is gone or can be a decline in money. It is important to grieve because it is also a way to release the stress. Releasing bad stress from the body through different actions such as crying may result in an ease of feeling. Grieving may also be considered as a sign of a capability of a person to heal and move on. People may also grieve after experiencing earthquake, typhoons, tsunamis, storm surges, and other natural disasters. These people may have lost their properties and other important things needed for everyday life. Others grieve for a misfortune such as losing any valuable material. Getting robbed or failure in an examination. People may also suffer from experiences such as separation from friends and conflict with others. There are stages of grieving. In 1969, a psychiatrist, Elizabeth Kubler-Ross, introduced what became known as the 5 stages of grief. These stages of grief were based on her studies of the feelings of patients facing terminal illnesses. But many people have generalized them to other types of negative life changes and losses, such as the death of loved one or a breakup. The first stage is denial. When we lost someone or something important to us, it is natural to reject the idea that it could be true. In turn, we may isolate ourselves to avoid reminders of the truth. Others who wish to comfort us may only make us hurt more while we are still coming to terms with the loss. The second stage is anger. When it is no longer possible to live in denial, it is common to become frustrated and angry. We might feel like something extremely unfair has happened to us and wonder what we did to deserve it. The next stage is bargaining. In this stage, we might somehow seek to change the circumstances of situation causing their grief. For example, a religious person whose loved one is dying might seek to negotiate with God to keep the person alive. Bargaining may help the grieving person cope by allowing them a sense of control in the face of helplessness. The fourth stage is depression. In this stage, we feel the full weight of our sadness over the loss. Feeling extremely down in the wake of loss is normal. However, it is important to be aware that the clinical depression is different from grief, and they are treated differently by mental health professionals. The last stage of grieving is acceptance. Accepting a loss does not necessarily mean the person is no longer grieving. In fact, many grief experts says that grief can continue for a lifetime after a major loss, and coping with the loss only becomes easier over time. Waves of grief can be triggered by reminders of the loss long after it has happened and long after the person has accepted it. If you are experiencing any of these emotions following a loss, it may help to know that your reaction is natural and that you will heal in time. While grieving over a certain loss is just a part of life, there are ways to help cope with the pain. Come to terms with your grief. Find a way to pick up the pieces and move on with your life. Here are the steps on how to deal with grieving process. First, acknowledge your pain. Second, accept the grief can trigger many different and unexpected emotions. Third, understand that your grieving process will be unique to you. Fourth, seek out face-to-face support from people who care about you. 5, support yourself emotionally by taking care of yourself physically. 6, recognize the difference between grief and depression. Let us now move on to our next topic, which is the mental disorders. Mental disorder is a disorder or disease that disrupts thinking, feeling, moods, and behaviors and impair daily functioning. This disorder may be caused by prolonged stress and mental emotional suffering due to various triggers. Now, triggers are events, conditions, or situations that may activate a person's tendency to experience symptoms of mental disorders. Here are the common mental disorders. major depressive disorder, bipolar disorder, schizophrenia, post-traumatic stress disorder. This time, we will discuss these common mental disorders, its signs, symptoms, triggers, warning signs, and prevention and treatment. Let's now go on to major depressive disorder. Major depressive disorder is a mood disorder that causes a persistent feeling of sadness and loss of interest and can interfere with your daily functioning. It is normal to feel sadness and grief when faced with difficult situations. However, a person may develop a major depressive disorder when depression is on a daily basis. For the signs and symptoms, we have the lack or loss of motivation, or nobody can motivate him. Lack or loss of energy, or he is feeling tired even he never do things. Slow to react. He or she has a late reactions in every situation. Loss of appetite, or a failure to eat regularly, or maybe excessive gain or easy to become slim or become fat. Withdrawal from others or feeling alone, or they want to be alone and they don't want to talk to others. Let's now go on to the bipolar disorder. This is also called as manic depressive disorder. It is a form of depression characterized by alternating mania and depression. A person who experiences this disorder may at times feel very happy and elated, and then at an instant may feel utmost sadness and despair. For the signs and symptoms, we have the rapid speech and racing thoughts. They have a quick changes of mind. Difficulty in decision making. They can't make decision easily. Recklessness and impulsiveness. They are doing things without care. Agitation, or they are disturbed. Difficulty in concentrating. They cannot concentrate on what he or she do. Let's now go on to schizophrenia. A person with this illness may experience hallucinations or feelings of being detached and away from reality. He or she may lose the functions of the sense organs and thinks and imagines very differently than of a normal person. For its signs and symptoms, we have neglect personal hygiene, disorganized thinking or speech. They are hearing voices. They have exceptional ability or fame, and inappropriate or bizarre posture. For the last mental disorder, we have the post-traumatic stress disorder. A person may have this disorder when he or she experienced a traumatic situation, such as being abused, raped, or involved in an accident. For the signs and symptoms, being spaced out or tulala, extreme sadness or frustrations, irritability, avoidance to people, or isolation. For the warning signs of these mental disorders, we have feeling sad or down, excessive fears or worries, extreme mood changes, significant tiredness, problems sleeping, and suicidal thinking. Knowing these warning signs can help you determine if you need to speak to a professional. For many people, getting an accurate diagnosis is the first step in treatment plan. For the triggers, we have the childhood abuse, trauma or neglect, social isolation, experiencing discrimination, poverty or death, and bereavement, or losing someone close on you. For the prevention, There is no sure way to prevent mental illness. However, if you have a mental illness, taking steps to control stress, to increase your resilience, and to boost low self-esteem may help you keep your symptoms under control. Follow these steps. Pay attention to warning signs, get routine medical care, get help when you need it, and take good care of yourself. It is important to remember that mental disorders are diagnosed. Only professional physicians may determine the illness being experienced by an individual. Furthermore, it is also needed to note that the symptoms of the disorders should be prolonged and repeated. Not because a person experiences one or two of the symptoms at one time, it does not mean that he or she is already diagnosed with that illness. For this activity, we have to identify if it is healthful coping strategies or unhealthful coping strategies. Type H if the statement is a healthful coping strategies, and U if the statement is unhealthful coping strategies. Number 1, eating junk foods. Number 2, listening to worship songs. Number 3, taking prohibited drugs. Number 4, drinking alcohol beverages. And number 5, reading good books. Number 6, attending Zumba class. Number 7, watching Netflix overnight. Number 8, talking to a friend. Number 9, sleeping too much. And number 10, jogging every morning. And the answers are, for the next activity, I want you to write the correct answers. Number 1, what disorder is called a manic depressive? 5 seconds starts now. And the answer is letter A. Number 2, when does a person may develop a major depressive disorder? 5 seconds starts now. And the answer is letter B. Number 3, what disorder disrupts thinking, feelings, mood, and behaviors of a person? 5 seconds starts now. And the answer is letter B. Number 4, which of the following disorders experienced by a person of being abused, raped, and accident? 5 seconds starts now. And the answer is letter C. Number 5, what situation may activate a person's tendency to experience symptoms of a mental disorder? 5 seconds starts now. And the answer is letter C. For the next activity, I want you to type true if the statement is true and false if the statement is false. Number 1, difficulty in concentrating and remembering is a sign of major depressive disorder. Number 2, a post-traumatic stress disorder is a disorder when a person experienced traumatic situations such as being abused, raped, or involved in an accident. Number 3, symptoms of the disorders be prolonged but not repeated. Number 4, even professional may not determine the illness being experienced by an individual. Number 5, You may consult first your friend if experiencing the signs and symptoms of disorder. And the answers are, how many scores did you get? Good job, learners. I hope you have learned many things about today's discussion. In this time of pandemic, maybe many of us are experiencing stress, loss, death, and grief. We feel down, sad, and depressed. But life must go on. We must be strong. Keep in mind those healthy strategies to cope with stress, and it will keep us going. Sometimes it's okay not to be okay. But always remember, you are braver than you believe, stronger than you seem, and smarter than you think. Let's always look on the positive sides of every situation. Life is short and wonderful. I may leave you a simple quote by Catherine Pulsifer. How we perceive a situation and how we react to it is the basis of our stress. If you focus on the negative in any situation, you can experience high stress levels. However, if you try and see the good in the situation, your stress levels will greatly diminish. And that's all for today. Thank you for listening and spending your precious time with me. See you again in our next Valenzuela live streaming in Mapeh. Again, I am your nurse, Marie Anthonette Soriano from Disiplina Village, Bignay National Hospital. As all, stay safe and be healthy. Goodbye.